So we're a couple minutes after 6, so I think we'll just jump in. This is going to be a pretty full evening. This is a talk that I do probably once or twice a year, just because gut health and inflammation is so prevalent, but it's very, very important to everyday life. It's just the foundation of where we are. So let's get started. So this is an enormous topic. I want to let everybody know that I fully believe that self-care is a discipline. It is not an indulgence. And I see that pretty much in every seminar, primarily because I think a lot of times we put ourselves last, and that's not necessarily always the easiest thing to do. So, when you're on an airplane and they're going through that little safety card in their backseat pocket there, she usually says, when the oxygen mask deploys, put yours on first before you can help others. So hopefully the information that you'll find tonight will be able to help you do that. So gut health actually starts in the mouth. That is that we're really a donut, right? We have a hole that starts here, it runs all the way through, out through the backside, but really there's an extension from our mouth that goes to the inner part of our ear as well as our sinuses. But as you go through the esophagus, goes down into the stomach, there's a little branch off of that called the lungs. And from the stomach, it then goes to the small intestine, then the large intestine. So usually when there's GI issues, when people have intolerances to foods, to spices, if they have gastric reflux, or if they have a lot of gas or bloating, that can also affect what's happening in our throat. And it can definitely affect what's happening in our mouth and our sinuses. So our oral health is very important. If we have a lot of tooth decay, if we have foul mouth breath, that can be really a very large signal that something else is going on. So it's important to take advantage of individuals that can really help through that process. One of the individuals that I really like to talk to are biological dentists. I think it's really different in the United States that dentists actually go to a very different type of medical training, whereas pretty much anywhere else in the world, dentists are they actually go to medical school with everybody else, and then they specialize, right? So then they move on to dentistry. The other reason why it's really important that we take care of our gut is because 90% of our happy hormone, which is our serotonin, is made in our gut. So if our gut isn't healthy, we're not happy. And about 70 to 80% of our immune system is made in our gut, let alone the food that our brain requires is also made in our gut. So if you have swollen gums, or if you brush your teeth and there's a little bit of blood, or you have bad breath, if you've got coverings in your teeth, like amalgams or silver fillings, those can actually contribute to a wide variety of bacteria and viral overgrowth, and sometimes even yeast or fungus, as well as protozoa. And that can have a huge impact on your cardiovascular health, as well as contributing to other issues that we also know as cancer. So we have to be very careful. Biological dentists can usually help us identify the pathogens or the balance of good bacteria and non-great stuff in our mouth, and also help with giving us some suggestions on how to improve that, how to change that. These are two products that I really, really like. Revitin is a toothpaste that does not discourage good bacteria growth. It actually has some CoQ10, it has vitamin D, it has some curcumin. It's flavored orange, which I personally really enjoy. It doesn't foam. It doesn't have a lot of sodium lauryl sulfate, so you don't get a lot of foamy with the toothpaste. But what I do really appreciate about this is that it's developed by a dentist for the sole purpose of enhancing oral bacteria or oral biome. Periogel is a hydrogen peroxide-based tooth gel that we know that hydrogen peroxide helps to decrease viral growth. So if you do have a viral infection, or if you've been exposed to virus, then this is also a really good product. If you use it too often, it can cause your gums to be a little bit more sensitive because it is hydrogen peroxide. But some people have actually reported that it helps whiten their teeth. I don't know if that's necessarily a good claim, but I've heard that from a couple of clients. And then the MD toothbrush that is there on the far right, the reason why that's in this picture as well is because it has a specialized handle. And when you look in the mirror, if you can see a plus sign, then you know you're holding the toothbrush at the proper angle to actually then thoroughly clean your mouth. So again, a toothbrush that is designed by a dentist, which I think is really cool. So there's a huge connection between what is going on in your gut and what is happening in your brain. It's even theorized that maybe the gut is the first brain and that what's actually sitting on top of our head is the second. And so Dr. Perlmutter wrote a wonderful book called Grain Brain, and he shows the very specific correlation to what gluten and how it impacts not only our autoimmune issues, but a wide variety of processes of inflammation, and how that then affects brain, mood, and even allergic reactions. There's other books that are out there that are written very well, but this is one that I really liked, that specific quote, mainly because when people come into the pharmacy or they call and they ask questions about mood and how to boost their energy, we usually talk about gut issues as well. There are ways to recognize what's actually going on. There is a very close connection between what's going on in your gut and how you actually age. There is a way to manipulate gut bacteria so that we can see a change from an overabundance of the bad guys to the good guys. And that will definitely improve not only health in the short term, but also in the long term. There's a wide variety of biomarkers that we can see going on in the gut, and we can test for specifics as well. So if you're looking at, are you looking for specific protozoa or specific parasites? There are tests that can show that as well. So everybody wants to grow old very gracefully, and I think that that is very important. It's not just an aesthetics issue, it's also about movement and memory, and that is very important to everyone. So when we're testing to see what's going on in the gut, there's several different ways to do that. Looking at micronutrients is a perfect way to do that. That's usually done in a blood draw, and there's several micronutrient labs that are available. And because a lot of times symptoms can be very subtle, they can be very slight, and we might just kind of think that those symptoms have to do with just everyday living. And some people are actually told, well, it's just because you're getting older that this is happening. Well, you know, I don't really buy that as a label, right? And yes, we're getting older, but that doesn't mean that you have to feel poorly. It doesn't mean that you have to feel run down and, you know, that you're just kind of listless. I don't think that that's the way anybody intends to age. For myself, I'm really looking forward to, you know, doing the things that I've always planned to. There's places I want to go, things that I want to see, and I want to be able to move and enjoy that, not just because doing that for myself, but I want to do that for my partner as well. Sometimes we see micronutrient deficiencies as a way that the gut is actually not absorbing very well. Sometimes we can see that when we all of a sudden have a broken bone. For example, 70-some-year-old woman is just vacuuming around the furniture. She slips and turns and voila, she has a broken hip. Well, that is a silent, kind of a long, insidious process that could be a metabolic issue as well. But osteopenia and osteoporosis are inflammatory issues that do have not only a gut relationship, but also other metabolic relationships, such as what's going on with thyroid. And of course, headaches, whether they happen once in a while or frequently, whether they're hormonally balanced or hormonally related, they can certainly be related to what's happening in the gut, whether you have enough of the good guys or even a couple of the bad guys that are causing that. There are genetic tests that we can look to see the health not only of your brain, but of your bones, internal organs, as well as hormone balance. The 3x4 genetics test looks at 36 core insights so that you can have this information and be able to make better choices for yourself. It's a very simple, easy to do cheek swab, kind of like some of the other genetics tests that are out there, like 23andMe or Ancestry. It is a very different platform than those. They do not necessarily link you with other people that you're related to. This is just a snapshot of what's going on with you. And really, it's a once in a lifetime test. So it's not something you have to repeat over and over again, but it does look at quite a few very helpful insights. Shows you how you metabolize caffeine, how you assimilate salt, what types of exercise are best for your genetic makeup. But with that, we're able to look at how the internal organs are working together to find good metabolic harmony. And that a lot of times is linked right back to what's going on in the gut. So Toni Marthaler is a nurse practitioner. She's in Green Bank. She's right now, that's the only person I know of that is doing this 3x4 genetics test. And I want to say it runs around $500, but that includes the follow-up consultation. So the other gut test that I came across in the last year is called BiomeFX, and this is put out by Microbiome. And what I really, really like about this is that it gives such specific information to what's going on in your gut right now. So whether you have irritable bowel disease or small intestinal overgrowth, if you've been diagnosed with leaky gut or you assume you have leaky gut, that's all can be related to insomnia, depression, weight gain, hormone balance, but even other metabolic issues as well. This test is a stool test. It's very easy to perform, and it looks at a wide variety of microbes as well as a full DNA sequencing. It is can be turned around in 2 to 5 weeks. I think the time right now that we're seeing is about 2 to 3 weeks for the results to come back. And there's usually a minimum of 20 pages. So the one that I saw the other day was 26 pages. A lot of it's in color, so it's really easy to read. I help you go through that. And that's something that you can use and take back to your practitioner so that together decisions can be made as to whether or not specific organisms need to be eradicated or other nutrients or supplements need to be enhanced. A lot of times, even using natural approaches, herbs and supplements can very much make a dramatic impact on correcting the gut. It does take time. It's not something that we're going to be able to fix inside a week. It does take several months, and we can always retest at a later time if there are unresolved issues. Oh, let me go back real quick. This test runs around $400 to $450, someplace in there. And Dr. Pam Smith, who wrote the book Max Your Immunity, will be joining us on our webinar in October. So October 28th, she will be talking about Max Your Immunity. And I believe she's going to talk a little bit about gut testing as well as the impact of what's going on in your gut to your immune system. So let's talk a little bit about digestive enzymes. Because if we don't have the right balance of digestive enzymes, we're going to have a really hard time breaking down our foods and assimilating those into the nutrients that are necessary to conduct overall health. So digestive enzymes can reduce stress on the digestive system. They can reduce inflammation in the gut, but also in the periphery, so elsewhere in your body. It improves the breakdown of food so that those nutrients can be assimilated into the other organs and the target tissues. It also helps support a healthy microbe balance, so a really good balance of the good guys versus the bad guys. And digestive enzymes have shown to reduce food sensitivities and allergies, as well as improve immune response within the body. All of this helps to enhance cellular energy production and reduces the possibility of autoimmunity, and also reduces some of the symptoms associated with autoimmune diseases. But we also see that when we not only correct the enzymes in the gut, but we can actually see improvement in tissues and skin. And it slows down the aging process. Collagen is one of my favorite products. This is two of the products that Bulletproof puts together. That's the chocolate flavor and the vanilla flavor. They actually contain XCT oil, which is an 8-carbon chain, medium chain fatty acid. It's a triglyceride. And there's also an unflavored, which literally has no flavor whatsoever. And it's not sweetened either. And it works very well in hot or cold liquids, or you can very easily throw it into a smoothie. When we're looking at the gut, I mentioned earlier that, we're really like a donut, right? We've got a hole that starts here, kind of winds around and comes out the backside. So the lining of the gut is skin. And a lot of times it can become very irritating. What's really different about the lining of the gut is that it's only one cell thickness. So it's got this very, very, very thin layer. Whereas the skin on your, like your arm or your legs, is anywhere from 8 to 10 layers. So there's some top layers, there's a middle layer, and then there's fatty layers underneath. And that's very different than what's going on in the gut. So if for whatever reason you have an irritation or a disruption in that skin layer, it can very easily break, it can stretch, it can slough. That can make for not only short-term issues, acute issues, but it can also make for long-term and even chronic disease states. We can see where even simple metabolic processes, the breakdown of foods, can then leave the gut, go into the blood supply and into the periphery, and even land on the skin. And that's why a lot of times there is eczema or skin irritation, rashes associated with allergies and food intolerances. Even with heavy metal toxicities can show up as skin rashes or irritations. So we apply, a lot of times we go to the dermatologist and we get creams or ointments to apply to the skin, but really what we need to do is we need to go back and look at what's actually happening in the gut. So anytime that we can enhance hydration, but also identify those specific intolerances or allergies, maybe it's to medications, maybe it's the fillers in a medication, maybe it has to do with something you've been exposed to. Maybe you inhaled a chemical, whether it's a perfume or it's a chemical from a dryer sheet or a laundry soap. Sometimes it's just a matter of plastics or, touching like cash register receipts. There's a wide variety of issues. And we also have a lot of mold in this geographic location, mainly because it's pretty damp around here. So molds and those kinds of toxins that can be in carpets, in floors, in walls, can also have a dramatic impact as to what's going on in our gut, because they can be inhaled or even ingested, and it can disrupt the metabolic processes in the gut. It can disrupt absorption, but it can also then cause inflammation and other issues. There are ways to test for those, and there's some very good medical providers in our area that have very good testing processes. As far as the pricing on that, I'm not real familiar with that. It really depends on the individual lab that's being used. So I get a lot of questions about probiotics. What are probiotics? How do they help the gut? Which one should I be using? How long should I be using them? And are there different probiotics because I'm a female, or are there different ones for men? Are there different ones for children? And what about those that have to be kept in the fridge versus those that don't have to be kept in the fridge? So let's start with some really good questions. Why are you wanting to use a probiotic? Some people want to use a probiotic because they've been using an antibiotic because they've had some other infection. Well, that's a great place to start. And that's usually when we start with really high dose probiotic, because when you take antibiotics for a bacterial infection, it wipes out not only the bad guys, but the good guys. Well, we got to put the good guys back. So identifying what those good guys would be a lot of times has to do with where you live. And also sometimes not only where you live, but if you're male or female. We also need to take a look at what other symptoms do you have? Do you have a lot of bloating? Are you burping? Do you have a lot of gas? Those are questions that need to be asked and answered as well. We also need to talk about what medications that you're currently taking, and also what types of dietary supplements or vitamins and minerals that you're using. The reason is because some medications can change the way probiotics are being utilized, and we want to make sure that we are getting the best product for you. So in this picture, we have several different types. If you are dairy or lactose intolerant, you need to be very careful about how you select good probiotic. Not all of them are dairy-free. When we are looking at replacing good bacteria after antibiotic use, we're going to want to start with huge numbers of probiotics. So we're in the billions. That's where the probiotic 225 usually starts off, and that's a 15-day course. Just to the left of that is orthobiotic 100. That means there's 100 billion CFU per capsule. And then from there, we can go down and change things as well. Now, there are some probiotics that actually go after yeast, and that would be something like Saccharomyces boulardii. But sometimes we also need to take a look at using other herbal medications that help with healing the intestinal lining as well. Whether we're using something like olive leaf, we can also use berberine. There's even glutamate, but all of these should be followed. That type of a regimen should be followed with a very knowledgeable health practitioner. So in short order, not all probiotics are the same. It really has to do with the quality and also the cell culture count. So we need to be mindful of your budget. Absolutely. Not all of them have to be kept in the refrigerator. Most of them do. Some of them are not in the refrigerator until you need to open them. Once you open them, then they need to go in the fridge. So be very mindful of what's on the label. And of course, talk to your healthcare practitioner. You're welcome to come in and talk to us in the pharmacy, and we will be happy to help you with that as well. So some of these probiotics are designed specifically for gut issues. Others are designed more for vaginal health issues as well. And some are designed for kids. Quite honestly, there are more cells of what should be healthy bacterium in your gut than there are cells in your entire body. Kind of crazy numbers, right? But we're literally talking trillions. So autoimmune diseases are quite varied. The area that we currently live in, if you're in Skagit County or Washington State, tends to have more of a variety of autoimmune disease diagnoses. So we see quite a bit of multiple sclerosis, fibromyalgia, Hashimoto thyroiditis, Graves' disease, which is another thyroid disorder or a mix thereof. And a lot of times when we see one diagnosis with autoimmune, we usually see another. So a lot of times if someone is diagnosed with fibromyalgia, they usually have a low functioning thyroid as well. or there may be something also classified as chronic fatigue. So there's a wide variety of labels that we put on autoimmune disease, but we can help get to the bottom of those. One of the medications that we use is a prescription, and it's called low-dose naltrexone. Doses usually start very low and are slowly increased over time. So the drug naltrexone has been around since 1964. It's an FDA-approved medication in larger doses, in 50 to 300 milligram. We use this for alcohol overuse syndrome and also for methadone withdrawal, etc. When we use low-dose naltrexone in little tiny doses, literally 0.1 milligram up to usually around 4.5 to 6 milligrams, then we're using it to not only decrease inflammation throughout the body, but also to modulate the immune system. I didn't say boost the immune system, I mean modulate the immune system. And the reason why I'm saying that is because some autoimmune diseases are a manifestation of the immune system kind of gone a little crazy. But this actually helps to bring the immune system back into kind of its normal working order. So LDN doesn't cure anything, but what it does do is it tricks the body into working on its natural pathways to then see more of a more efficient way of healing. So it can actually change the way we produce pro-inflammatory chemicals in our body. It actually will slow that down. We can see a change in the way LDN works to decrease allergic response. It will also intermittently bind to pain receptors. So if you're using narcotics or synthetic narcotics or narcotic-like medications, we have to be very careful about using low-dose naltrexone because it can block its activity, and literally that medication may or may not work for you. Most of the time it doesn't. Low-dose naltrexone currently is compounded only, and that's a wonderful thing because we can dial in on the dose that is specific to you, but also we can dial in on what form of the medication is going to work best for your lifestyle. A lot of people use capsules. There are tablets available that are compounded. There are sublingual drops. Troches are little tiny square devices that are dissolved underneath the tongue. But we also use transdermal low-dose naltrexone for autistic individuals. And we use topical when we're wanting to soothe the skin and work on autoimmune diseases of the skin, such as Hailey-Hailey disease, lichen planus, lichen sclerosis, things like that, even atopic dermatitis. Some of those have an autoimmune component. So I'm an LDN consultant. I've actually completed my LDN master certificate. I am one of 4 in the world that is an LDN master. That means I've done a lot of studying on my own. It also means that I coordinate with a wide variety of LDN specialists, literally all over the world. A lot of them are in the UK, some are in other parts of Europe, but we're very fortunate to have an enormous brain trust of scientists, bioscientists, as well as medical practitioners all across the United States and Canada that are very, very open to sharing their clinical experience as well as their scientific papers that they've written. Currently, there's over 900, closer to probably 950 medical articles and case studies written on low-dose naltrexone. It is one of the most studied medications, well, with the exception of the coronavirus vaccines that we have currently, which I find really interesting because there are so many physicians that are not aware of LDN, and they're not aware because it's not toted by a big pharma company, but that's okay. I can fill in those gaps and help with the understanding of how low-dose naltrexone works. When we use low-dose naltrexone, we're really talking about doses of 0.1 milligram up to 4.5 to 6 milligram. If we dive down into the microgram dosing, we're now calling that ultra low dose. And we can then use it simultaneously for individuals who are trying to get off their pain medications. So sometimes people will have chronic inflammation, whether it's in their joints or in muscles, and there can be a gut component to that. And we can actually use digestive enzymes to help reduce inflammation as well. But when somebody's using pain medications, hydrocodone, oxycodone, tramadol, and they want to get off of those medications, we have successfully helped people with 15, 20-year narcotic addictions use microgram dosing simultaneously. So they're using ultra low dose naltrexone with their pain medications different times during the day. And as they decrease their opiate use, we increase their ULDN dose, and we literally substitute one for the other. And then we work them up into low dose naltrexone dosing. And a lot of times we're able to control their pain, but we're also then reducing their inflammation and getting at the target or the root cause of what's really happening for them. Many patients report that they have all these other wonderful symptoms that just kind of disappear. Sometimes they lose weight. Sometimes they actually feel a little more energy, or their depression has decreased, their anxiety has decreased. And that's a really wonderful thing when we hear from patients during follow-up consultations, or they just call and they're calling for a refill, and they say, you know, by the way, I'm actually a whole lot happier than I've been in a long time. Now, some of that could be because they're no longer taking opiates. Other times it's because low-dose naltrexone is reducing inflammation throughout the entire body, which is then allowing them to be happier because the body is able to work on its metabolic processes and organ processes the way it's supposed to. We do use naltrexone in low doses for osteoarthritis, rheumatoid arthritis, polymyalgia, and also chronic regional pain syndrome. Now, there's a physician who has recently filed for a new drug application specifically for chronic regional pain syndrome. And we'll see what his scientific study and his processes actually bring to light. I'm really looking forward to what he's able to put together. One thing that we have developed at Makers is a really easy way to help you increase your doses. So this is a suggestion of a naltrexone titration starter kit. And what this means is that we provide you with 2 different strengths. So as your provider writes the prescription and it would start at a 0.5 milligram, you would slowly increase that every week to then get up to about 4.5 milligrams inside 9 weeks. Well, instead of taking this huge handful of capsules before you go to bed, which means you have to wash it down with a fairly, large glass of water, that means you're getting up in the middle of the night. So that's a little counterproductive. We actually provide you with 2 different color bottles and 2 different strengths of medication and a guide such as this to help you understand the dosing regimen over a period of time. Just makes it so much easier and very straightforward. What it also provides is that not everybody gets to 4.5 milligrams. Some people feel better at 3 or 3.5 milligram, which means that as they increase their dose, if they don't feel as good as they did before, we simply bump them back down, because with LDN, less is more. Seems a little counterintuitive with some medications, but this is not a typical pharmaceutical medication. Yes, it's a prescription, but it works so differently at small doses as it does at larger doses. Now, naltrexone is also available in combination with bupropion called Contrave, and we use that to help people lose weight. And that's fairly successful for some people, but it only works in about 30 to 40% of the population. LDN has worked in so many different avenues. We have seen, we've seen it reduce inflammation in the cardiovascular system. We've seen it go after breast cancer, lung cancer, even different types of lymphomas. We see it in cancer treatments combined with other medications. It's not necessarily a sole entity, but it can be combined with traditional chemotherapy, and it can also be combined with non-traditional medications such as dichloroacetic acid, vitamin C, things like that, infused milk thistle as well. And there's a wide variety of studies available on that. We have seen it reduce blood sugar counts and hemoglobin A1Cs. It reduces inflammation in the gut, such as ulcerative colitis and Crohn's disease. Now, those are two thought of as autoimmune diseases of the gut. And Dr. Leonard Weinstock is one of the leading gastroenterologists who has used low-dose naltrexone for almost 20 years in his practice with great success. One thing that I have also noted is that when we are dealing with viruses or underlying issues such as fungus and yeast, so if we're dealing with psoriatic arthritis, for example, sometimes there is a bloom, so people might feel worse before they feel better. And that happens a lot even with underlying viral infections such as Epstein-Barr. And it was described, and I really appreciated this analogy. So during the last LDN conference, which was this last June, there was this wonderful naturopath from Arizona. And she was saying that in her practice, because she deals with a lot of viral infection and a lot of gut issues, that she equates this to your immune system is working on absolutely everything 100% of the time, 24/7. When you use something like low-dose naltrexone to help decrease some of those issues, perhaps 2 or 3 of those issues disappear. So now 100% of that immune system isn't spread over this much space. It's now concentrated. So perhaps it's going to uncover other areas because of its concentration of activity. Well, therefore, it might actually cause something to happen. So that has happened to her, and how she described it is she was helping someone who had some irritable bowel issues. She had a wide variety of kind of leaky gut situations. It was thought perhaps she had Crohn's or ulcerative colitis. They hadn't actually pinpointed that, but she definitely had skin issues as well. But she also had a variety of mood disorder. Well, come to find out, after using low-dose naltrexone for about, I want to say about 3 or 4 months, they actually discovered she had Epstein-Barr. So, which is a viral infection that tends to manifest in a wide variety of issues and a wide variety of symptoms, but they were able to then use other medications to help treat that. Beauty of low-dose naltrexone is it's not only low dose, it is low risk. It has very few side effects. And what I mean by low risk is that it doesn't really interact with other drugs. We have to be careful with biologics because of suppressing the immune system, and this will modulate the immune system. So we don't want to be counterproductive. And we also have to be careful if somebody is using opiates, but that's about it. It's also a very low side effect profile. We might see a little bit of constipation because of low-dose naltrexone binding to the opioid receptors in the gut. So it can actually slow the gut down a little bit. That doesn't happen in very many people. Some people report vivid dreams, which can be scary in some situations, but that's a good thing, because then we know that LDN is actually causing you to deep dive into REM sleep. And a lot of people who have chronic inflammation, chronic gut issues, have sleep disorder. And so they don't sleep very well. So they don't dream. And maybe that's been going on for years, if not decades. Well, with low-dose naltrexone, when it allows you to dive into REM sleep, now all of a sudden you're dreaming. And that can be, really different experience all of a sudden. So people report that as kind of a side effect. it does tend to go away. In very, very few people do we hear a little bit about headaches. And again, that is a change in inflammatory markers, but it can also be a change of what's going on in the gut, as well as enzyme changes can change the thyroid pattern and how the thyroid actually works, which can also change headaches. It is compounded, but it's also inexpensive. A 3-month supply of a 4.5 milligram capsule from our pharmacy anyway is about $77, which is very reasonable for a lot of medications. This is a website that we developed as the LDN pharmacist. You can find a wide variety of medical journals as well as reference materials. If you have questions about any of the information that's there, please reach out. You can actually do that directly either through our regular website or through the LDN pharmacist. There are even some veterinary applications of LDN, which is really kind of cool too. We actually watched it was a beagle mix who had been diagnosed with a cancerous tumor. And when they started low dose naltrexone, they actually gave the dog about 4 extra months. And that dog was actually acting like a puppy the majority of the time. And this was a 14-year-old dog, I think it was. And it really did slow the progression of the tumors until the dog actually had some other metabolic issues changing. And actually what happened is that it stumbled and it broke a leg, and that kind of did him in, unfortunately. But with the LDN pharmacist, we can connect you with information on the LDN Research Trust, as well as a wide variety of other practitioners that might have more information for you. Hormones in the gut are key. We have to make sure that hormone is balanced as well. So we're not talking about just estrogen, we're talking about progesterone as well as testosterone. There are estrogen receptors in the gastrointestinal tract. So estrogen and hormones, if you are lacking in those, can actually change the way the gut works. If you have too much, that can also change the way the gut works. And quite honestly, hormone replacement orally has a dramatic impact as to what is happening in the gut versus a topical application or even a sublingual application of hormone. I think it's really important to test to make sure that we're applying and replacing hormone only what's needed. We certainly don't want to cause any more harm. That's absolutely absurd to do that. So testing, in my professional opinion, is absolutely needed. And with time and age and weight changes and lifestyle changes, dietary circumstances, we usually change hormone doses as well.
Michelle, there's a question in the chat. So back on the LDN and inflammation slide, you mentioned the name of a gastroenterologist, I believe.
Yes.
Repeat that.
Yes, that's Leonard Weinstock. And he is I believe he's in St. Louis. He wrote a chapter in the first LDN book, I believe. I think he actually wrote a different chapter in the second LDN book. So there's the LDN book volume 1 and LDN volume 2. But he contributes almost every single LDN conference. So you can go to the ldnresearchtrust.org. You can listen to the previous conferences. I warn you, they're 2.5 days long each. They go back as far as, I think, 2014. And there are usually, oh golly, there can be anywhere from 10 to 20 different practitioners speaking at each conference. I believe the earlier conferences you can review free of charge. This last conference, there is a charge for that. There is medical CE, there is educational CE for medical practitioners, as well as pharmacists and nurses. And there's also the LDN masterclass that's out there as well. But you can find.
I'm sorry. Follow-up question. Is there a local gastroenterologist that prescribes LDN?
Oh, that's a great question.
We
Mm,
might have to do some digging and
yeah.
get back to you
So,
about that one.
um, a lot of times specialists have their list of medications that they use, and many times they're really not up on some of this kind of side stuff. So we're more than happy to provide information, whatever's necessary. Always happy to do that. Usually Scarlett and I do that on like a daily basis, right, Scarlett? I mean, it's just, we're happy to do that. I can send reference materials electronically or in paper form. That is no problem at all. We have copies of the LDN book, volume 1 and volume 2, that are available to medical practitioners as well. And my favorite article that I like to provide to medical practitioners is what I call the Dartmouth article. It's actually written by that article is written by a physician. And what he did is he summarized the first 900 articles that were written, and he put those into categories based on disease state. So he has a list of the disease states, the authors, the dosing routine that was provided in each one of those articles, as well as a summary of what that article provided. Very, very helpful, especially if you're seeing a gastroenterologist, maybe even a rheumatologist, maybe even a neurologist, and maybe that there's going to be different articles that are applicable to the different disease states. Maybe you've even got a thyroid specialist. It's, but it's all there for you. So that's the first one I like to hand out, but we have access to a lot. There has also been probably, I can think of at least a dozen other articles that were published in the last year or two. So even with the pandemic, the research on low-dose naltrexone continues. And I find that just absolutely fascinating. There are two research groups in Chicago and one in New York that's actually looking at low-dose naltrexone and its implications in COVID, because we do know that low-dose naltrexone will interrupt the production of interleukin-6. And interleukin-6 is the primary cytokine that produces inflammation when the coronavirus actually attaches, especially in the lung, which then allows for fluid to fill up. And if there's an interleukin-6 storm, we know that death is pretty close. So they're actually looking at using LDN to help with that process. I think it's super cool. So that's our LDN pharmacist. Does anybody here know anything about stress? I was just kind of throwing that out there. This last 18, 20 months has just been a ride, right? And stress has a very dramatic impact as to what happens in our gut. It can change the enzymes that are produced. It can change how much acid is produced. And stress over time not only has short-term implications, but it has long-term implications as well. And it really is one of the biggest contributing factors to long-term aging and health risks, mainly because of what it does to our bones and to our muscles and really to our brain as well. Stress is a killer. It's number one killer. So there are ways to help support that. We can do that with herbal medications. We can do that with very specific vitamins, but there's a wide variety of kind of non-nutraceutical pathways as well. So ways to calm yourself just by simply breathing, not hyperventilating, but slow rhythmic breathing. And also turning off your screens, before you're going to go to bed will definitely help support better sleep patterns. Sleep hygiene is really important, but during the day when you are feeling that imminent cloud of stress just surrounding you, you can step out of that and breathe. I like to use theanine. It's a natural amino acid that's very calming. Theanine works very well with a wide variety of other medications as well. And also make sure that you're hydrating. And I like to add a little lemon, maybe cucumber, maybe a single mint leaf to my large water bottle throughout the day, because not only does that help with detox, but it helps to control stress as well. There's ways to also meditate or pray to help reduce your stress levels. And that can definitely change the amount of acid that's being produced in your stomach. So perhaps less burping, less gas, less bloating. And that's always very helpful. So oxytocin is a natural hormone that's made in the brain. Dr. Lindsay Berkson wrote a fabulous book called Sexy Brain. Really great read, really easy to read. And she talks about oxytocin throughout her entire book. It's really kind of fun. But oxytocin is a hormone that is also called our cuddle drug. It helps us feel connected. So when we give birth to a baby and baby is put on our chest, oxytocin just floods our bodies and helps us to connect with that child. It also helps us to feel warm and calmer. It is also released during hugging and direct intercourse. Women produce much more oxytocin than men, but it still works in men. We usually compound that in a nasal spray. And the reason is because the nerve in the nose, in the sinus passages, is the only one that directly connects to the brain. So we used to use oxytocin in a sublingual lozenge and a little lozenge that would go into the tongue. But what we found through third-party testing is that oxytocin is so sensitive to heat that it wasn't as potent when we put it in a troche. So we primarily use oxytocin in a nasal spray, but we can also use it in a vaginal gel for a non-hormone way to repopulate that. Because quite honestly, when we're looking at the digestive tract, we can't forget the kind of side pieces to that, which is also the urinary tract and also the vaginal health. Oxytocin helps with breastfeeding, especially depression and libido. And we've even seen it prescribed for grief. So again, this last 18 to 20 months has been very difficult as we've been losing a lot of loved ones. And we find that oxytocin is perhaps one tool in the toolbox that can help with that process. And this is just a picture of one of our nasal sprays. When we look at a variety of vitamins and supplements, vitamin D, vitamin D, vitamin D. I don't think we get enough of it in the Pacific Northwest. And this weekend, we're going to see that our weather is going to change significantly. So we're going to see a lot more clouds, a lot more rain and drizzle. So therefore, that sun is not going to be able to interact with our skin and help us produce vitamin D. But it's really important to keep your vitamin D nice and high. This is a perfect time to test your vitamin D, by the way. Because if your vitamin D isn't over 60 or 70, your immune system will not be optimal and overall health won't be optimal. So if you can get a little blood test done to see where you're at, that way you can prepare yourself for going into the gray winter months. In my professional opinion, I don't really think we have a flu and cold season. I think we have a vitamin D deficiency season. It's not uncommon that our vitamin D levels plummet, especially when we start hitting December, January, and February. Because of the stress of the holidays, we usually succumb to really crappy eating habits and really diving into those carbohydrates and sugars. But we also have a whole lot going on starting in October and then going through the holidays and New Year's Eve. And then we start to slow down in January. But if our immune system is not optimized and modulated, then we have more susceptibility to a wide variety of virus that's with us literally 365, right? It's not just happening a few days out of the year. Most viruses are around all the time. So besides vitamin D, I also think that B complex is a great place to work with. So the Bs need to be changed to a methylated form to be assimilated into the cells to do their work. There's a wide variety of B vitamins that are very, very necessary, not only for mood, but to help also convert kind of our sleepy hormones to our happy hormones. So tryptophan to serotonin is mediated by vitamin B6. But we also need to look at vitamin B12 to help with mood and muscle and bone integrity as well. Vitamins are also helped with a wide variety of mineral supplements. Magnesium is fantastic. So some forms of magnesium can really disrupt the GI tract, primarily magnesium oxide. So Haley's MO is used as a laxative. It is magnesium oxide. It's not one of my most favorite forms of magnesium, I got to tell you. Magnesium glycinate is one of my most favorites because it's very easy on the digestive tract. But when magnesium is swallowed, it is the glycinate form actually pops off and turns into glycine, which also helps to heal the inner lining of the GI tract. And then the magnesium is very calming. It's a natural muscle relaxant, helps to regulate blood glucose. And magnesium is literally mandatory in over 400 chemical reactions throughout the body. That is really supportive. It also helps with sleep. It's fabulous. So people who have restless leg sometimes have an issue going on in their gut as well, but magnesium is very helpful even with restless leg. Sometimes low-dose naltrexone is used as well. And then probiotics. We talked a little bit about probiotics. There are also prebiotics, which help the bacterium, the good bacterium, to flourish and to gain better threshold. And if your medical professional is aware of all of these, they can definitely hold your hand through that. But otherwise, we can help you with that. So these are just a few supplements that we use. Melatonin is available in a tablet form, is also as a liposomal spray. And some of the liposomal sprays, which are placed under the tongue, also help with calming. So they might have theanine. You do need to be very careful if you are taking an antidepressant that you not grab something that has GABA, G-A-B-A in it, because GABA will literally reverse those antidepressant medications, some of them anyway, and might actually send you into orbit. So if you're using some of the SSRIs like sertraline, paroxetine, fluoxetine, citalopram, escitalopram, something like that, venlafaxine, you got to be careful with those. And glutathione, fabulous stuff. So how do we actually work really well for keys to success? Usually, if we can build something into our everyday routine and make a habit out of it, we're going to actually get better results. So we also need to find out what's going to be best for you, not only best for you as in the types of products or also assimilating with the medications that you're currently taking, but also to find out what form is best to take it in. This is actually a variety of teas that do provide some nutrient and supplement sources. There are ways to actually hack your neurological system. So when we're looking at dopamine, dopamine is very helpful to help us feel accomplished, help us to feel successful and powerful. And we can do that by eating very specific foods and really diving into taking care of ourselves. You can increase your own endogenous oxytocin by playing with a dog, loving on a fur friend, holding somebody's hand, hugging a person. And I will say female to female hug actually produces more oxytocin than hugging a female to a male hug. And that's because there tends to be more synergy between women. You can give someone a compliment. Not only will they have an increase in their oxytocin, but you will too. If you meditate or learn calming mechanisms, by which we also call prayer, or different techniques of meditation through yoga or Pilates, even just walking barefoot outside in the grass or in the dirt, you can actually increase your serotonin. Laughing will increase your endorphins. Low-dose naltrexone does that as well. Exercise also increases endorphins. Endorphins are natural painkillers. So all of this will help. All 4 of those chemicals can also help heal the gut, but also support our brain. Oh yeah, and who doesn't like a little dark chocolate once in a while? So these are some of my favorite virtual teachers. I want to thank you for allowing me to share this last hour with you. I feel very honored to be in this position with my pharmacy and with my pharmacist, and also with our Director of Education and Marketing, Ms. Scarlett. And we've had virtual teachers for a very long period of time, and they've made a huge impact in our lives. These are a couple of our websites and a few emails. If you'd like to get a hold of us, we're happy to do that. Certainly tune in. Let us know how we can help you by, if you think of questions that were not answered tonight, or additional questions that you might think of a little bit later, please let us know how we can help you. Look us up on social media. You can like us on our YouTube channel as well. We've got a couple more seminars coming up the rest of this year. Like I said, Dr. Pam Smith, who is a world-renowned educator on LDN, on hormones. She's also written a book on immunity, and she's going to be joining us on October 28th, called Max Your Immunity. And I'm really looking forward to that one. In November, we're going to go over women's health, and we will address hormones, the different ways to balance that, a wide variety of vitamins. We'll talk about LDN. And then in December, we're going to specifically hone in on autoimmune issues and low-dose naltrexone. So thanks again, everybody, for being here. Scarlett, do we have any other last-minute questions?